You're right. I did forget to do that. Thank you.
Uh-huh. So you might want to go back over just for those who weren't on here, because that was a lot of really good information you had.
Okay.
Just briefly.
Thank you. Okay. Here we go again. So now that we're recording, everybody can hear me and see the recording?
Yep.
All right, thanks. So anyway, so we're going to do, I even had it written down to do that and I forgot. So we're going to be going over the basic traditional Chinese medicine principles. And I'm just going to kind of start from the beginning. The goal for me for this is the expected outcome is going to be teaching basic principles in traditional Chinese medicine to enable us to identify a TCM pattern. And then the third session is going to be putting it all together, and I will show you some useful acupressure points. So let me introduce myself. I am Dr. Jodi Van Tine. I'm an integrative practitioner in Lincoln, California. I work in a conventional practice, and I hold the eastern part of the practice. I do food therapy, acupuncture, Chinese herbal medicine. I got my master's degree in immunology in San Jose State in 1982, earned my veterinary degree in UC Davis in 1994, received my certification in veterinary acupuncture through the International Veterinary Acupuncture Society in 2006. Through the College of Integrative Veterinary Therapies, I got a graduate diploma in veterinary acupuncture and veterinary Chinese herbal medicine. And then I now am an instructor for those courses. And the set of 3 sessions is part of a teaching certification that I have wanted to do for a while to become a better teacher. So I wanted to recognize all of you. I appreciate you all being here. We seem to have a wide range of backgrounds, which is awesome. This course is intended for pet parents and technicians to get a better understanding of basic TCM principles. And I hope you find something here that you can take with you and learn. So now we'll start. The history of traditional Chinese medicine started in 1766 to 1066 before Christ. It was practiced first on people, and then it was applied to animals on the domestication, first of horses, and then our smaller animal companions. So TCVM is Traditional Chinese Veterinary Medicine, which started as TCM for people. TCM is very old. It includes herbal medicine, acupuncture, food therapy, Qigong and Tai Chi, and Tuina massage. We're going to focus just on basic TCM pattern recognition tonight, but if there's any interest in herbs or food therapy, we can certainly set up some other sessions to go through those. So we're going to be looking at basic TCM theories, and this is actually the first one that I'm going to present. Health is a state of harmony and balance, a state of balance between excesses and deficiencies. And if you have disharmony between those, that's the cause of disease. So in one instance here, you have excess hot external yang versus the polar opposite of deficient cold internal or yin. And an example of an excess hot external or yang individual could be a golden retriever that has hot spots, ear infections, or fever. An example of a deficient patient would be an elderly cat that's thin, cold, and weak, maybe a cat who's in the final stages of chronic kidney disease. So this is called 8 principles, and it's just one TCM theory. So let's look at some others. So the basic theories that we're going to talk about today are the fundamental substances, the cooking pot, and the Zongfu organ systems. And part of the Zongfu organ systems will also include the 5 elements. The 6 evils is the last basic theory that we'll talk about. From those, I also wanted to expand a little bit on the relationship between the spleen and the kidney, and then go over some patterns for pain and inflammation as well. So I'm going to talk quite a bit about this. This one I think everyone's familiar with. It's the Tai Chi symbol of Qi, which is composed of Yang, which is the bright white area that's rising, hot. It's the fire, the sun. It has a masculine character. It's an excess and it's active and rising. Whereas yin is the opposite. It's cold, it's sinking, it's feminine. The water and the moon are yin characters. It's more inactive, deficient, and possibly sedentary. Yin and yang are interdependent. They cannot exist without each other. The combination of yin and yang make qi, which is what we think of as the vital body's energy. It's the vital life force. It's function and movement. Some equate it to the function of the mitochondria, which are the organelles in the cells that take oxygen and transform it into energy for the body. It is a dynamic. It's between function and substance, and it's a continuation between material and immaterial. The qi is function. So if you have qi deficiency, you're going to see loss of function. And an example of that would be large intestine deficiency, where the body fails to be able to move stool and becomes constipated. Qi is usually not in excess, but it can be deficient and it can stagnate or stop to move. And we'll go through some of those things later. What I see in practice, that's a good example of the interdependence between yang and yin, is when our elderly patients, or people, I think too, there's that bright moment where they're really coherent and they're all present and they're running around and they're eating and they're feeling really good and they're very yang. And then they have periods of time or bad days where they're more quiet and sedentary and they may not eat and they just don't move a lot. And so what I always tell people is the good days will get farther apart and not as good, and the bad days get closer together and not as good. And so what you're seeing there is you're seeing this separation of yin and yang. Yin holds yang down, but when you get yin or jing deficient, it starts to not be able to restrain that yang energy. And so that's where you have those bright moments of lucidity and those good days. When yin becomes unable to restore or to hold yang and yang floats away, that's that bright moment of lucidity that you see your life before your eyes. And then when yin and yang finally separate, that's death. So let's look at the fundamental substances. Fundamental substances are, let me go back. I forgot something. I wanted to talk about the states of imbalance between yin and yang. You can have a true excess of yin or a true excess of yang. You can have a deficiency of yin with a relative excess of yang, or you can have a deficiency of yang, which makes a relative excess of yin. So it's really kind of how much of the circle each one holds. If you have an excess of yin, so the black area here is bigger, you're going to see signs of what's called deficiency heat, and you'll see things like swelling, edema, diarrhea, and mucus. If you have an excess of yang, that's going to be more like that golden retriever I told you about. You may have a fever, you'll have heat, and you'll have increased thirst because they're trying to add yin to cool off that excess heat or fire. If you have a deficiency of yin, this is smaller, and so that the yang area is relatively larger, but the signs are a little bit different in that the animal will be dry and hot and seeks cold, but probably won't have a fever or increased thirst like with a true yang excess. If you have a deficiency of yang and the white area of the Taijin symbol is smaller, then you're going to see things like dilute urine and heat seeking. There's a little graph in your handout that shows an illustration or a chart example of the relative relationship between yin and yang and the 4 possible states of imbalance. So now let's move on to the fundamental substances. So the blood is not only in Chinese medicine what we think of as the red stuff, but it has 2 sources. It has the hormone from the kidney, the erythropoietin, that is what we usually think of that goes to the bone marrow to stimulate red blood cell production. The other source of blood in Chinese medicine actually comes from the spleen qi, or the digestion. The spleen in Chinese medicine is more of the microvilli and the digestive function of the small intestine and the pancreas. It's not that red organ that we typically think of that has the more of a hematopoietic. It's different. So the spleen and the digestive function receives food that's rotted and ripened by the stomach, absorbs that energy, and sends it up to the upper jiao, to the heart and lungs, where blood is manufactured. And that's a solely traditional Chinese medicine principle. Blood nourishes the hair, the nails, the tendons, and ligaments. It's stored in the liver. It's circulated in the heart. And it also provides a residence for the shen, or the spirit. We'll talk about that in just a minute. The essence is your jing. It's your genetics. So it's really kind of depends on what you're born with. What are you going to look like? What's your hair color? What's your eye color? How long are you going to live? What diseases are you going to be more likely to get? What kind of characteristics you have? And it's stored in the kidneys. The jing is a part of yin, and it's your essence. It's the other part to your qi. And there's a slide that we'll talk about how the spleen qi and the kidneys are related. The shen, or your spirit, is your mind, your mental and emotional state, your awareness. It lives in the blood, and it's stored in the heart and nourished by blood. So if you, for example, have blood deficiency, you're going to have shen disturbances, which can be anxiety, panic attacks, agitation, aggression, perhaps, because your shen, your spirit, doesn't have a residence in which to reside. And so you get a shen disturbance. The last one here is the fluids, or the jin yang. These are the thin body fluids that are the kind of counterpart to blood. So when the spleen transforms the gu qi, or the essence, from food up to the upper jiao, it makes blood and these fluids. And these fluids are the interstitial fluids, the fluids in the organs and the tissues, semen, intestinal fluid, gastric fluid, and tears. So if you have a deficiency of body fluids, you not only get a combination of dryness, but you also get a formation of damp, which is a pathologic form of these fluids that is more viscous and tends to cause some other problems, and that we'll look at in a bit. Everybody hanging in here? We've gone over this again, so we might be getting into new material here pretty soon. All right, back to the triple burner. So I really like the cooking pot and the triple burner and the zongfu organs. The triple burner, or sorry, the cooking pot divides the body into the upper, middle, and lower burner. So there's 3 parts. The upper burner is the part above the diaphragm. The middle burner is the part of the abdomen right below the diaphragm. And the lower burner is the part of the abdomen really below the kidneys, and includes the bladder and the prostate and the uterus. So the cooking pot is really, I just like it because it exemplifies the metaphors of Chinese medicine. What happens is when you eat food, it goes into the stomach, and the stomach rottens and ripens the food and sends impure fluids down into the small intestine. And the spleen absorbs the pure fluids and transforms and transports them up to the upper burner as the gu qi, which are transformed by the heart and the lung into vital substances, qi and blood. The lungs' function is to disperse and descend this vital mist, and this mist descends down to the kidneys, where the kidneys grasp the fluid and use it for their processes. The heart takes the blood and the yang, or the qi, warming energy of the heart, and that warming energy descends into the space between the kidneys called the Ming Men fire. And the heart yang warms the kidneys, which is especially important because the kidneys provide the fire under the cooking pot, which is the stomach, to be able to rotten and ripen the food. The liver, again, is sitting here, and it stores blood. The spleen and the liver kind of sit side by side, so they have a very interesting relationship. The triple burner isn't one of the zongfu organs per se, but I'm just going to talk about it here. The triple burner is a very unique kind of a pattern. I'm not going to go into it in a lot of detail because it's a little bit complicated and sometimes difficult to understand. Some people equate it to the lymphatic system inside the body, but it's essentially an internal conduit between the middle, upper, and lower jowls. And so what can happen is if you get an obstruction of the triple burner, then you get a blockage right here in the middle, and you get an inability of the lung qi and the heart yang to descend and warm the kidney. So it gets cut off. And so there's a specific pattern that you'll see with a triple burner obstruction that's called hot above and cold below. So because the heart yang and the warm energy can't descend from the upper burner, it gets stuck up here. And so you see red heat, red eyes, coughing, vomiting, the energy and the heat that normally should be descending and circulating, it gets stuck. And so subsequent to that, you get coldness in the lower burner. So you get hind end weakness, you get low urine concentration, and you get what's called azotemia, where the kidneys, they don't get nourishment and they don't get the Mingmen fire. So they start to decline. The other thing, as far as laboratory values go, if you work in a clinic, is you'll see a mild elevation in the liver enzymes, and you'll see high platelet counts, and you'll see high cholesterol. So you kind of get this hot above, cold below pattern with some other things clinically. And it's kind of interesting, and it's actually fairly common in our elderly patients. But this is just, it's kind of a nice way of looking at the body and how all of these are related. Does anyone have any questions on that? Okay. So now we're going to move on to the Zong Fu organs. The Zong organs are the solid organs. And again, note that the first letter is capitalized. The liver, heart, spleen, lung, and kidney are the solid organs. And then their relative organs are the gallbladder goes with the liver, small intestine is paired to the heart, the stomach is paired to the spleen, the large intestine is paired to the lung, and the bladder is paired to the kidney. So there are a number of interesting things that go along with the Zong Fu organs. For example, they have emotion that goes with them. They have a taste that goes with them. They have a season that goes with them. They have body systems that go with them. And they have a pathogenic factor that goes with them. So for example, the liver, the emotion of the liver is anger. The liver, because it stores blood, is the organ that's going to be involved in nourishing the tendons and ligaments. The flavor of the liver is sour. The liver opens to the eyes, and it generates wind. It's the main source of internal wind, and its season is the spring. So we'll go over here and look at the spleen as another example. The emotion of the spleen is worry. The spleen governs the muscles, and the taste is sweet. It opens to the mouth. So the gums and the lips and the mouth are a reflection of the spleen and the digestive system. The pathogenic factor associated with the spleen is damp. So this is kind of an interesting way of looking at some of the things that we're going to see and what TCM organ they might be associated with. So for example, if you have an animal that worries a lot, that's always worried, the constitution of the spleen, it's the earth element. And so those are the animals that are really laid back, and they like to eat, and they're pretty sedentary, and they worry a lot. Those are the animals that are going to be prone to having a spleen qi deficiency. Where the animals that are more of a liver or a wood element tend to be kind of angry and irritable. They're kind of grumpy all the time. They may be prone to tendon and ligament problems, and they may show eye problems like dry eye, which is from a liver blood deficiency, or red eyes that can be from a liver fire or liver heat. And there's other things that can go along with these. So for example, those little dogs that hide under the table, and they may come out and bark at you, and then they go run and hide. Those are kidney or water element dogs. They're fearful all the time. So this is in your handouts, and I apologize, it's kind of a horrible slide, but I wanted to just let you know that this is in your handout. It talks about the different 5 elements, and then down here in the middle, it shows you the zong and the fu organs that are associated with each element, and the seasons and a number of other attributes that weren't included on the previous slide. I'm going to go back to this slide for just a minute here, just to point out another thing as far as 5 element theory. So these are the 5 elements: earth, metal, water, wood, and fire. And so there's a supportive cycle where fire makes earth, think of lava, earth makes metal, metal dams water, and water feeds wood. Wood nourishes fire. So there's this supporting element cycle here of the 5 elements. There's another cycle where they actually control each other. So if you think metal controls wood, well, you chop down a tree. Wood and earth, you dam the earth. Earth and water, you dam the water. So there's this controlling cycle as well. And one of the really important cycles that I see a lot in clinical practice is the relationship between the wood and the earth element, the liver and the spleen. And we'll look at that again in a bit. So now we'll go back to the table, and we've already seen that. So again, that's in your handout, and this might be something useful when you're going through and trying to determine what organ is involved. You can look, well, do I have, green colors that occur in the spring? And then down here at the bottom is the tongue part. And that's going to be one of my favorite topics that we'll cover in the second session. So I'm going to go back, and we're going to talk about the spleen chi a little bit, because I think in our current environment, the spleen and the digestive function is really important. It's tremendously dependent on the diet. But again, the spleen chi is the digestive function, or the microvilli and the microbiome. And it's where the food is digested in the intestines and transformed and transported across the gut barrier into the circulation. And those nutrients are transformed and transported through the liver up to the upper jiao. That function can be damaged by excessive worry and stress. Stress has a known negative effect on the microbiome in the intestines. Processed food disrupts the normal microbiome. If you figure a cat eating kibble, it's 70% starch, and they don't have the enzyme to digest the carbohydrate, that's going to create problems and damage your digestive function. And dogs eating kibble as well. Also a lack of exercise. So you have these animals that eat a kibble diet, they're home all day, they don't get to exercise, they're kind of bored, they just kind of sit around, they're going to gain weight, and it's going to damage their digestion and cause some other problems. Those problems, when the spleen chi becomes deficient, is the generation of damp. Now, remember, we talked about the jin ye, or the thin normal body fluids. This is a pathologic form of yin that's called damp. It circulates where yin goes, but it's more viscous. And so it generates chi as it generates friction as the chi tries to flow across it. And that's where you get damp heat. Tina has a question. So are animals by nature equated with one element, or is it about the state of health? That's a good question. So you can look at an animal and determine, is it an earth element? Is it a wood element? Is it a heart element? The heart element, for example, is if you think of Pomeranians or Yorkshire Terriers or Frenchies, they're like in your face. They want all the attention all the time. They're very joyful. They almost have a joyful excess. Those animals are going to have a heart or a fire constitution, and that's part of their genetic makeup. If you look at one of my examples, again, with the little Chihuahua that's fearful all the time, those are going to be the water element. And again, it's your constitution, it's your basic makeup. People and dogs that are kind of laid back and sit on the sofa and like to eat, those are going to be the earth element. And so it can be about their state of health, but their constitution can give you an idea on what type of issues they're going to develop in their disease. Thanks for that question. So going back to the damp, if you're generating blood deficient or dampness instead, you're sacrificing the ability to make blood. And so you get this combination of damp and blood deficiency. So what you start to see is you see kind of dryness on the top, and you start to see redness or swelling kind of develop. And then over time, that qi trying to flow through the damp viscous fluid generates heat from friction. And that's when you get inflammation. So that's when you start to see red ears, red skin, gingivitis, those kinds of things. Inflammation is itis, it's damp and heat. So if you think of damp as swelling and heat as the red color, anytime you see something that's swollen and red, that's inflammation. That's the TCM pattern for inflammation. And then concurrent with that, you're going to get blood deficiency. You get Shen disturbance, dry skin, dry tendons and ligaments. And the itch is, oh, dry skin's on there twice, must be important. And then you get a milder itch. With blood deficiency, the itch is milder. When you start to get into damp and damp heat, the itch will get more intense. And then I'm just going to note here the liver qi stagnation. So if you get blood deficiency, you're also going to get liver qi stagnation. There's a relationship between qi and blood that we'll go over in a later slide. And so you'll also get irritability. So what you get is you get a weak spleen over here, and then you get kind of an angry, irritated liver and qi stagnation. And so you start to see irritability and things like the liver beating up on the spleen. It gets stressed, and you get stress-related vomiting or diarrhea. And that's something that I saw a lot when I worked in a facility that had boarding, is the dogs would come in, they'd get a diet change, a sudden diet change, so that would damage their spleen. They're in a stressful environment, and so they commonly would break with diarrhea and bloody diarrhea in that situation. And that's the explanation why. So now I'm going to move on to the 6 pathogenic factors, just kind of, or the 6 evils, just kind of touch on them. Again, we talked about damp, that damp is a pathologic source of the Jianye or fluids. Phlegm is a continuation of damp that we talked about, and we'll talk about more. Wind is anything that moves. Wind is really the major factor. It can be generated internally by the liver and dryness and blood deficiency, and the liver's actually one of the major Zongfu organs that's involved with seizures. Anything that moves is wind, itching is wind, and seizures are wind, so anything that moves. It can also carry pathogenic factors, any of these really, into the body from the outside. So for example, you get an insect bite or you contact poison oak, that's going to be a wind heat invasion. You can also get a respiratory virus, and that can be a wind heat invasion. Wind invasions are typically acute. They're invasions. A trauma could be a wind invasion also. Wind cold would be something that you might see with an acute onset of lameness and joint swelling perhaps, or increased pain in an elderly patient that is already kind of cold. You get an invasion of more cold, and things get more stagnant and exacerbate there. So these are just kind of some other things that can be contributing factors to the TCM features that we see in our patients and our pets. So let's look now at a couple other concepts. And this is kind of, I talk about this every day because I think it's really important. The relationship between the spleen and the postnatal qi, and the kidney, which is the prenatal qi. So we've gone over the prenatal qi is your jing and your essence and your genetics. That's pretty well set, and it's held by the kidney. Your postnatal qi is determined by your spleen. So you figure when you're born, you're, a neonate, a little puppy, a little kitten, they have to eat in order to survive, because they immediately start using up their prenatal qi or essence. So what you eat, and eating in your postnatal qi is very, very important. So the spleen, you're constantly using up your jing or your essence just by going through life. I think of it kind of like a bank account, and you're born with a certain amount. You're not going to get more genes or more genetics than you're born with, unless science intervenes, and that's a whole nother topic. But the way that you can support and keep your bank account of jing as full as possible is to supply good nutrition and maximize your spleen qi and your postnatal qi. So your spleen qi goes and nourishes your kidney, and then your kidney provides the fire under the cooking pot to facilitate your digestion to optimize the manufacture of postnatal qi. So there's a relationship between these. So if you think of our patients and pets that are eating a dry processed food, and we talked about the effect of processed food, damages the microvilli, damages that gut barrier, so you get leaky gut syndrome. And instead of making good, healthy postnatal qi to go back and fill up your bank account, it gets kind of wasted as the production of damp heat and inflammation. And so if you instead change to a whole food diet, so in a cat, maybe a raw meat-based diet, or a dog with some meat-based omnivore, whole foods and food and nutrition the way the body's designed to recognize it, then you're going to maximize the function of the spleen. You're going to have optimal spleen qi function, and you're going to put into your bank account and keep that bank account as full as it can be. So that's why diet is really important in preventing disease and treating disease, really. Does anyone have any questions about this? I think it's a really important concept. Okay, great. So as far as inflammation goes, again, pathogenic factors, damp and heat. Remember that the mouth is the opening to the spleen or the digestive tract. And so gingivitis really is a reflection of the state of the GI tract. The intestines are also epithelial surfaces, so you'll also see inflammation of the ears and the skin, and perhaps some involvement of the lung tissue, because those are all epithelial surfaces as well. But this is largely a result of processed foods, again, inappropriate diet and worry, causing leaky gut syndrome and systemic inflammation. They've actually seen that there can be bacterial factors in other areas of the body, that they isolate the source as the intestines, because the leaky gut syndrome allows bacterial lipopolysaccharides to enter the systemic circulation. And that's going to be involved in damaging your kidneys. It's going to be involved in obesity. It's going to be involved in joint inflammation. And in this illustration here, there's a syndrome, gingivitis, stomatitis in cats, where it can get so severe. It's also it has an immune mediated component to it, but it can get so severe that their only way to resolve it is to pull all the teeth, full mouth extractions. And I don't know about you, but full mouth extractions hurt my heart. I can't imagine a cat with no teeth, because they kill prey and they're meat based, they're predators. And I just see that it's really sad that we don't focus on feeding them the healthy meats and their normal species appropriate diet. And instead we prescribe prescription foods and kibbles that continue to damage the spleen qi and cause inflammation, and then end up as needing to require extractions. Thank you, Brandy. I'm just going to say just a little interruption here. There is now a canned food that for cats that has mouse. It's actually chicken, turkey, rabbit, and mouse. And if you read the list of ingredients, it's like turkey meat, whole mouse. So anyway, there's hope for cats, and that's it. And we'll move on to the next slide. Thanks. I've waited all my life for a mouse-based cat diet. Okay, so here we go. The relationship between qi and blood. So blood is the mother of qi. Blood nourishes qi. Blood nourishes qi and helps it be healthy and provide normal movement and motility and function. Opposite of that, qi is the commander of blood. So again, qi is movement and function. And so qi actually is really important, excuse me, in blood circulation. So if you have a blood deficiency from the causes that we've already talked about, the qi is going to slow down and the qi is going to stagnate. And so things stop moving. When you have a qi deficiency, then you're also going to get blood deficiency leading to qi stagnation, but you're not going to be able to move the blood. And so you get blood stagnation and stasis. So you kind of get this progression from spleen qi deficiency to blood deficiency and qi stagnation, and then blood stagnation and stasis. This is one of the ways that cancer forms when you see these red masses like hemangiosarcoma. And that is in the spleen, like the red organ, but that in combination with phlegm is a major player in the formation of tumors. So now we're going to move on to pain. I think pain is probably under-recognized, but it's really, really important. It's typically treated in conventional medicine with pain medicine. There's, Silencia and Librela now for dogs, and nerve growth factor, monoclonal antibodies that block nerve growth factor. But they don't really talk so much about different patterns of pain. And I find that this is really interesting because it's really important when you're proposing a TCM pattern. So there's two types of pain, excess pain and deficiency pain. Excess pain is typically worse after rest. Like for me, when I get up in the morning, it takes, I don't know how long it's going to take me to get down the hall before I can actually be moving and not be stiff and sore. That's qi stagnation pain. It's worse after rest, and the animal typically will warm out of it, okay? There's two types of excess pain. One is qi stagnation, which is kind of a dull pain. It comes and goes. It's migratory. It's not always in the same place. And again, it's kind of just a dull ache kind of a pain. Blood stagnation pain is severe, fixed, knife stabbing, sharp, really bad pain. So I always wonder, these animals that get liver tumors and hemangiosarcomas, they don't always show blood stagnation pain, but those are definitely blood stasis and stasis heat masses. And so I do think that they are painful. So those are the two major patterns of TCVM excess pain. There's also deficiency pain. So sometimes you'll take your dog out for a run and it takes a little while to get warmed up, and then it does really well. But then you go out to the lake and they're running around and they're doing really well. And then at the end of the day, you just see them start to limp and get really painful. And by the time they get home, they've used up so much of their qi that they can't move things. And so those are the deficiency pain that's worse with activity. Usually I think we start out with excess pain, and then as things progress and the animals get older, then you get more deficiency pain, and you can actually see both of these. And then another thing that I think is recognized more with Eastern medicine than Western is what's called Wei syndrome, which is weakness. So you may have arthritis at first, and the arthritis, the osteophytes, and the changes in the bones and the joints that you see on x-rays. But then over time, you see maybe like from the waist back, the dogs start to lose muscle mass and they get weakness in their hind end, and they have more difficulty getting up, and they just don't have as much qi because they're deficient. And so there's a combination pattern in TCVM called Wei B syndrome. B syndrome is pain, and it's a channel obstruction, and it's a blockage of the qi movement and the energy. And that's the painful part. And then Wei syndrome is the deficiency part. And they typically occur in combination in our geriatric animals. So in summary, we've gone over the fundamental principles and patterns, the fundamental substances. I should probably put the 8 principles in here as well. That was our introduction. Yin, yang, and qi. We looked at the cooking pot analogy, and just keep in the back of your mind the triple burner. We looked at 5 elements and Zong Fu organs. We looked at the 6 evils or pathogenic factors, and then we looked at the relationship, excuse me, between the pre and postnatal qi, the spleen qi, and the kidney qi, and the different things that manifest as disease. Inflammation, damp heat, again, goes along with perhaps blood deficiency, excess and deficiency, a combination, pain as B syndrome, and then weakness as Wei syndrome. So where do we go from here? We're going to take a short intermission, and then in session 2, and I will promise to remember to start the recording right away, we're going to look at the 4 examinations and tongue diagnosis. And this is going to get us into kind of how do we investigate and how do we grasp and ferret out some of those things for, like for the Zongfu organs. What kind of constitution does an animal have? What emotional states have they experienced or do they have that might influence their TCM pattern? And then we're going to have some homework between the 2nd and the 3rd sessions for you to kind of pick out an animal and see if you can determine its TCVM pattern. So that's going to be it for session 1. Does anybody have any questions?
Jodi, I don't have any questions. And I know this is a little bit of an inappropriate timing. I should have put my hand up earlier. I was wondering if you could just touch real quickly on the colors of foods and how that, getting all of the colors of the rainbow in a bowl, and that addresses kidneys, heart, liver, and then the amounts of foods obviously would change based on if you're trying to support the spleen or, that type of thing. But I didn't know if you could just touch on the colors of foods and how that relates to the organ systems.
Okay, thanks. That's a really good question because colors and foods are really important. I thought for this introduction that would be too much. And so kind of my plan was to maybe have another session and look specifically at food therapy.
Awesome, I'm in.
Because we could do a whole hour on colors and blood tonifying foods and yins and all of that. But unless we have kind of the basics, we won't necessarily be able to look at treatment, which I kind of look at food therapy as treating.
Awesome.
Thanks, Lee. Anyone else? Okay, so I'm going to stop sharing my screen. I'm going to stop the recording, but we're going to use the same Zoom link. We're going to use the same Zoom link.